Description of anatomy and physiology of respiratory system. So respiratory system is vital to life, and the main function of respiratory system, as you all know, intake of air from the external environment, and then exchange of gases between oxygen and carbon dioxide at the lung tissue level and the blood tissue level, and removal of waste gas, which is carbon dioxide, from the tissues. I will explain this procedure when I will explain the description of all the respiratory tract system. So it has two parts: upper respiratory tract and lower respiratory tract. Upper respiratory tract, first it is nostrils, which are the two external openings of the nose. And after the nostril, there is a nasal cavity. Nasal cavity, which we also called as turbinates or concave. Main function of nasal cavity is to provide filtration and humidity to the oxygen, and it also provides warmthness to the oxygen and maintain the temperature of oxygen. And nasal cavity has hair, which helps to trap the bacteria or dust or pollens. It has mucus too, which helps in removing the bacteria. And nasal cavity is also connected with paranasal sinuses. So paranasal sinuses are the air-filled spaces which is present in the bony structure of face. Sinuses like frontal sinuses, which is present above the eyebrows, and ethmoid sinuses below the eyeballs, sphenoid sinuses behind the sphenoid bone, and it is here, and then maxillary sinuses below the cheeks. And the function of paranasal sinuses is also the same, providing filtration and warmthness to the oxygen, and it helps in reducing the weight of skull, and also helps in removing the excessive drainage of mucus. And at this level, like nostrils and nasal cavity, there are some pathological conditions too that can obstruct nasal breathing. Like if somebody has nasal polyps, which are benign tumors that can affect the nasal breathing, or maybe deviated nasal septum, in which there is a deviation to one side of the nose, which can cause trouble in nasal breathing. And sometimes there can be inflammation of the sinuses too, which can be caused by bacteria, viruses, fungi, or infections that can cause swelling of the sinuses, which ultimately results in headache or swelling or nasal difficulty in nasal breathing. And after the nasal cavity, there is a pharynx region. I'm still talking about the upper respiratory tract. Pharynx comes in under upper tract. In the pharynx, there is one part which is called nasopharynx. So nasopharynx is basically connected with the nasal cavity. And function of nasal pharynx is the same, to provide filtration and humidity to the air. But it has one more major function. Nasopharynx contains lymphoid tissue, which we also called adenoids, or we called as nasopharyngeal tonsils, that are the first line defense mechanism that help to fight the infections against all the pathogens, that tonsils or adenoids. And they start increasing in size till 5 years of age or 6 years of age, and after that it shrinks. But in some conditions, it can grow bigger and bigger and can cause pathological abnormality, which we called as tonsillitis or adenoid hypertrophy, which can be caused by many several factors like infections or bacterial infections. And in Western science, surgery is the ultimate treatment to remove the adenoid hypertrophy. And on the lateral side of nasal cavity, nasopharynx, it is connected to the middle ear through Eustachian tube. And this Eustachian tube helps in balancing the air pressure between the air and also helps in removing excess of mucus through the middle ear. So you will notice, like sometimes if you have stuffiness in the nose, you can also feel stuffiness in the air too, right? So this is the main reason, because nasopharynx is connected to the middle of air too, middle part of air too. And after the nasopharynx, there is a part which we call as larynx. Larynx basically helps in sound production, and it also prevents the entry of food and water into by going into the main respiratory tract, which is the lungs. So there are some pathological conditions at pharynx and larynx level 2. There might be pharyngitis or laryngitis too, which can cause soreness of throat, or something like coughing, hoarseness of voice, sometimes feeling some obstruction in the throat. These are all the symptoms of pharyngitis and laryngitis. Laryngitis can also affect the sound because it helps in sound production. So after this, there is a lower respiratory tract which starts at trachea. So first part is trachea, then there are primary bronchi, then secondary bronchi, then tertiary bronchi, and after the tertiary bronchi, there is alveoli. Trachea is the main stem. Then at the trachea, there is a bifurcation into two branches, which goes into right lung and left lung. Right lung has 3 lobes. Left lung has 2 lobes. In the trachea, in the right lung, the main structure is we can say the big structure is primary bronchi. Then it can divide into small branches like secondary bronchi, tertiary bronchi, and ultimately it bifurcates into air-filled sacs, which we called as alveoli. There are millions of alveoli sacs in the lungs. These are millions, 600 million in our lungs. And these, the main function of this is entry of oxygen to the lungs, and at the level of alveoli, there is a actual gaseous exchange of oxygen and carbon dioxide. There are lots of capillaries around the alveoli. So first what happened, oxygen comes to the lungs, and then the tissues which produce the carbon dioxide, they exchanged this oxygen and carbon dioxide at the blood and tissue level and remove the carbon dioxide. There are some conditions too, like in the deoxygenated blood, which we called as carbon dioxide, that also heart collects all the deoxygenated blood from the body, and then oxygenation happens at lungs level, and then main oxygenated blood, which we called as oxygen, that goes into the left part of heart to whole body. So this is how they works. First, working at the alveoli level, which is direct connection of the lungs and the blood. And second connection, exchange of gases through how the heart and lungs. That sometimes at very extreme stage, like when somebody has left ventricle or like hypertrophy of the heart, then they can affect the breathing pattern too, because there it is a arteries, it is exchange of gases at the arteries and veins level. And there are pathological conditions at the lungs too, like bronchitis, which is the inflammation of these lining of bronchial tubes. And then there can be pneumonitis, which is the infection of lung parenchyma that can be affect one lobe, two lobes, or the spaces between the alveoli, which we called as interstitial spaces. So these can be result into cough, difficulty in breathing, wheeze. Wheeze, sometimes you will notice that there is a like barking like sound coming through the mouth like this. That is a wheeze. And maybe chest pain, difficulty in breathing, bluish discoloration of the skin. That are all the bronchitis sign. And we can differentiate like why it has bronchitis, because it is basically caused by viral infections, and pneumonitis caused by bacterial infections. In pneumonitis, there may be low-grade fever, and the respiratory rate may be increased in both stages. So these are the abnormalities at the lower respiratory tract. And sometimes there can be pathological conditions which affect the membrane around the lungs. So membrane around the lungs, which we called as pleural membrane, that provide protection to the lungs. So there can be conditions at that level too. And sometimes gastroesophageal reflux, which is like production of lots of acids, that can affect the pharynx. And ultimately, it can affect the bronchioles or bronchitis. That can be also not the main factor, but the secondary factor of bronchitis too. And there are conditions like asthma, which can cause airway inflammation that can be caused by like seasonal allergy or dust. And as Manglan Anand, sorry, Nas was asking smoking, how smoking affects. In Western, they only said this thing that smoking contains a one chemical compound which causes constriction of the bronchial muscles, which ultimately causes the obstruction of oxygen travel through the lungs. Because there are some involuntary and voluntary muscles or smooth muscles which covers the lungs, and they are in these muscles, they work through the brain by sympathetic nervous system and parasympathetic nervous system. So there are two systems in the nervous system. Sympathetic always causes constriction of the blood vessels. Constriction, then air won't, then there is a difficulty in the breathing of, in the movement of air. And parasympathetic always causes relaxation of the air, relaxation of the muscles, so that air can go. But there is always balance between parasympathetic and sympathetic. When there is an excessive constriction of the bronchial muscles, that can make difficulty in traveling of air. And when there is a excessive parasympathetic supply, then there is a permanent dilatation of the parasympathetic causes relaxation. Then there is a permanent dilatation of the bronchial tubes. Then that can also affect the air breathing, because lungs has elastic recoil-like effect. Whenever air comes, volume expand, chest cavity expand, pressure decrease. That's why movement of air happens into the lungs. And due to its elastic recoil nature, lungs has to come to its original position. So that's why carbon dioxide expelled. And inspiration, it is active process, because there's a like volume and pressure, they are involved. But expiration, it is a passive process, like because of the lung recoil, elastic recoil nature of the lung, it always comes to normal position, and then carbon dioxide expelled out. So there are some conditions at these levels too. So this is what about the clinical anatomy and physiology of the respiratory system according to Western science. If you have any question, then you can ask me about this.
That was like a speed course. lot to take
Saddam,
in.
that was beautiful. Oh my goodness. I feel like I'm getting schooled. I can't wait to go back to work and just have my intubated patients and think about their lungs. That was wonderful. When you were so eloquently sharing, I'm thinking about our patients that have things like empyemas, where there's an accumulation of pus and things in their chest cavities. Would that, if we bring it back to Marshall, when you shared your previous question, that's part of the 6 stages, right, of a disease. So there would be a weakness to the lungs from some kind of behavior, increase in kapha, dosha in that area. Is that kind of very not as eloquent as you guys put it together, but it kind of, for me, this simplifies it as you go through the system. That's kind of how we're looking at it. We're looking at where this weakness come from, what kind of behaviors, is it external, internal, or mental that cause this final, okay. And then I love that you shared heart failure, talking about heart failure, because you're right, the left ventricle issues is a big deal in our world. So where does that come from? Because I mean, is that also just like lifestyle choices? It obviously comes from our digestion, but can you talk a little bit more about heart failure and Ayurveda a little bit? Maybe not today if you don't have time, but I just find that really interesting.
I can talk in very simple way. Like heart has 2 parts, right part and left part. Right part always receive carbon dioxide, like deoxygenated blood, the blood which is not good. And the left part always receive good blood, oxygenated blood. So heart also helps in like deoxygenated blood, all the bad blood. Heart collects from the body through whole body as a waste product and goes into the right heart. And then it goes through the one artery, which is called as lung artery or pulmonary artery, and then goes to the lungs. And then there is a exchange of gases at that level, oxygen and carbon dioxide exchange at the lung level. And then after that, oxygenated blood, which is good blood, comes to the heart at the left part. And from the left part, it goes to whole body for their functions and organ system. And whenever there is a right part hypertrophy or left part hypertrophy, left ventricular hypertrophy, then they can affect these gases exchange too. So that's why at the last stage of heart failure, you can find some findings in the lungs too, or you have cough, difficulty in breathing too. So we have to differentiate at that stage, whether it is due to lung failure or heart failure.